Hello and welcome to this webinar. In the next 30 minutes, we're going to discuss the modern methods for the replacement of your missing teeth. My name is Dr. Joseph Schmilian, and I want to welcome you to this event. It is a recorded webinar that you're attending, which is broadcast a number of times through each day to help those patients who really require information prior to making appointments with their dentist to really know more about this particular type of dentistry, which I call keyhole implant dentistry. The reason why I refer to it as keyhole implant dentistry is because it is the most painless, affordable, and desirable method to replace missing teeth. Now, many practitioners are unaware of this technique, and I conduct seminars regularly to help practitioners understand how they can help their patients with the most conservative and refined manner possible to protect them from unnecessary damage to their natural teeth and from the unpleasantness of having to wear removable dentures. But prior to getting onto the information I want to share with you, just a little bit of background about myself. I'm actually the senior dentist at Chatswood Preventive Dentists and the senior implant dentist at the Australian National Centre for Keyhole Implant Dentistry. I hold a fellowship in implantology from the International Congress of Oral Implantologists and in microdentistry from the World Congress of Microdentistry. I'm also an international lecturer in this field known as keyhole implant dentistry. Now, I've conducted many seminars over the years, and these are all practitioners who've gained their certification by attending my seminars. But the most enjoyable activity that I'm really involved in is really helping patients one-on-one. I love teaching practitioners. However, nothing beats being able to help my patients get rid of their dentures or to eliminate those unsightly gaps between their teeth or their back teeth. Now, if you need to contact me, pardon me, if you'd like to contact me at my surgery, which is located in Chatswood in Sydney, here's the phone number. If you'd like to get a pen or a pencil, mark this down. It's 02 9411 5116, 02 9411 5116. Or if you wish to send me an email with an inquiry, by all means do so at admin@anckid.com.au. That's admin@anckid.com.au. I'll give you that information later on again because I have a special little gift for you. If you stay to the end, you'll be able to benefit from, well, a little surprise that we have for you. And at the same time, the address and phone numbers will be available again. Now, replacing missing teeth with non-removable porcelain crown and bridgework is the ideal answer. We want to do that without damage to your adjacent teeth, without cutting the gums, without stitches, without pain and swelling, obviously, because none of us like to have that sort of issue, without a lengthy healing period, and without high cost, but with proven high success rates of 96% over 10 years. The options you have at the moment to replace your missing teeth basically are removable dentures, whether they be acrylic, as you can see up here, acrylic dentures, chrome dentures, or you can have non-removable options such as a bridge, surgical implants, or keyhole implants. I'm going to go through each of these briefly so you can understand exactly what the variances are, what the differences are, and see which one you prefer. Now, removable acrylic partial denture basically is unnatural. It covers the palate. As I mentioned, it is removable. It may damage adjacent teeth with time. It's subject to breakage. It can strip the gums from the teeth, and it's retained by unsightly wire clasps, as you can see. So these are not really desirable. They're quite unpleasant to wear. So unless you absolutely have to, for a temporary period, one stays away from that type of denture. A removable chrome partial denture is your other option, which basically is, again, unnatural. It covers less of the palate, but may damage adjacent teeth over time. It is subject to breakage and retained, again, by unsightly wire clasps, as you can see. This, too, we find many patients will not tolerate unless they absolutely have to. For that reason, a technique was developed called porcelain bridgework. And porcelain bridgework requires that we carry out permanent damage to adjacent teeth, and for that reason, we prefer not to use it. It's not possible if the gap is too big. In other words, if there's a very large, expansive missing tooth structure. And it's not possible if there's no back tooth. For example, in this case, where this patient had no back teeth on the right-hand side at all. So bridges can't be utilized unless there is a tooth on either side of the gap. But as you can see from the diagram, the first diagram here, it requires permanent damage and reshaping of those teeth, which can lead to further problems. With regards fixed reconstructions that are not removable, a conventional surgical implant is one excellent option, but it has a few drawbacks. It's been around now for a good 35 to 40 years, and but it does require that the gums are incised, are cut open. It requires the removal of healthy bone structure from the jaw, requires stitching, requires up to 6 months of healing. It has complex componentry, as you can see, segments that are two-stage. One section is embedded in the bone structure, the other section is connected to that structure, and the fee can range up to $10,000 per tooth. And the final results basically are achieved 6 to 7 months after surgery. As you can see from this diagram, we have the implant within the jawbone. The abutment is connected about 6 months after that is surgically placed in the bone, and a porcelain crown is placed on there at that time. Again, because of the cost and the surgical intervention, it is something that most patients can do without, because we do have a better technique in the form of the keyhole implant procedures that I'll talk about in a moment. So surgical placement of an implant requires incision, precise drilling of the jawbone to create an implant site around 4 to 5 millimeters in diameter and up to 18 millimeters deep prior to implant insertion. Suturing of the wound is required, and the healing phase is about 4 to 6 months, I've already mentioned. So the jaw must be drilled. A precise channel must be prepared. So with a number of drills, starting from a narrow drill to a very wide drill, depending on the size of the implant to be used, depending on the width of the jaw. And there's an issue in the lower jaw. That arrow is pointing to a tiny little hole there, which depicts the presence of a nerve channel that runs under our lower teeth. That nerve channel, if damaged by these drills, can cause permanent damage to the sensations to the teeth and especially to the lip. If that nerve is severed, there is no hope that you'll ever regain the sensations of touch, heat and cold sensitivity on your lip at all. So it's a serious matter to have an implant placed in the lower jaw, especially if the practitioner is young or inexperienced. So here's a diagram showing the implant in place in the surgical site. As you can see, it's quite broad and it does require substantial bone removal, which is something I am quite opposed to. So, as I mentioned, there's a nerve channel underneath those teeth, which mustn't be violated. So here's the implant in place. Having placed this implant surgically, then 6 months later the top is uncovered and, as I say, exposed 6 months afterwards, and little abutments are placed like this, screwed through. So this component here, the abutment, is connected to the implant itself using a small screw that connects through the center. Now, unfortunately, that screw can sometimes loosen over time, and it's quite frustrating to find that the cap is, in fact, the final crown, as you can see here, actually starts to jiggle and wiggle around. So it's a technique that is wonderful, but not completely foolproof. Screw retained abutments are the foundation for the crowns, as I mentioned. So a conventional surgical implant often requires additional bone grafts. Now, this is a problem. In the first diagram, you'll see a tooth sitting, a cross-section of a tooth sitting in the bone structure. When that tooth is extracted, the bone starts to shrink. When left for many years, the bone has shrunk so far that an implant is unable to be placed within that width there. Accordingly, this block here, this rectangular block, is taken from somewhere else in the jaw. Usually it's the chin, and is screwed in place. You can see two little screws running through that, two little screws that are running through the block there, here and here, to hold that in place so that the bone graft takes after a 6-month period, and a wide implant can be placed in that bone structure. Now, When we use keyhole implants, we don't bother with this because we can actually place an implant in those narrow ridges very effectively without the need for surgery, without the need for bone grafts or taking bone from the chin or elsewhere in the jaw. So there it is. You can see the tooth, the extraction site, the narrowness of the ridge, even more so, the graft, and of course the final implant. Accordingly, let's say goodbye to this technique because it really is no good if you've got narrow jaws, narrow ridges. If extractions are performed quite a while back, you've lost tremendous bone structure and you need a narrower technique, a narrower implant. Here's another diagram discussing the way in which bone grafts are attended to. You can see here the first arrow indicates the loss of bone structure and a graft placed, unfortunately, there we are, and a graft placed under the gum. Needless to say, to do that, that gum's got to be cut and peeled back off the jawbone so that can be placed in position. And once it takes, usually 6 months later, that's when the implant can be placed. Now, I just want to warn you, this next picture is a surgical site, a surgical image. It does depict the donor site where bone is taken away from the chin, and you may or may not want to look at it. So here's the extent of the cut. The cut is right along the edge of the lower teeth, and that bone, a square section of bone or rectangular section of bone, is chiseled out and then placed in what we call the receptor site. If there's too much bone structure missing, that is placed in under the gum. You can see the extent of the cut. We want to avoid all of this unpleasant surgery. You're going to find out how the keyhole technique really is so wonderful. It's so quick and none of this complex treatment is required. So let's say goodbye to this technique once and for all. Look at the difference between a keyhole implant, the narrower one versus the thicker one. So as we discussed, a conventional surgical implant requires surgery, requires removal of healthy jawbone, 4 or 5 millimeters of bone removal, up to 8 millimeters in depth, requires up to 6 months for healing, has complex componentry, often requires additional bone grafts. The fee can range up to $10,000 per tooth, and the final result takes the best part of 6 or 7 months to be completed. That's provided you don't need a bone graft. If you need a bone graft, add another 6 or 7 months on top of that. Now, the benefit of the keyhole technique, keyhole surgical implant, is that no surgery is required. It's minimally invasive into the jawbones because we only drill in 1 or 2 millimeters in diameter at the entry point, and it's only about up to 6 millimeters in depth. Because as you can see, this is a sharp-ended implant. It is self-tapping. It engages itself into the bone structure without having to drill in the channel excessively deeply, unlike these big wide implants which are blunt on the ends and they are not self-tapping. We create an immediate result with this as opposed to a 6-month waiting period for healing. It's much simpler componentry, and for that reason no bone grafts are needed, which is wonderful. We have very high success rates, exactly the same sort of success rates as the wider implants, and the best part is that, of course, it's far more affordable at around $2,900 to $3,600 per tooth, about nearly virtually a third to a half the cost of conventional implant. Obviously, because it's a much simpler technique, much more desirable technique. So what actually is keyhole implant dentistry? Well, I showed you the images of the surgery involved in doing this and the other implants, but let's have a look at this concept. You can see the actual entry point is so tiny. It's only 1 to 2 millimeters in diameter. It's an access through the gum, through the bone, and that gives us immediate access to actually insert the implant and seat it within a matter of a few minutes. Pardon me. So here we are with 3 of these mini implants, 3 of these keyhole implants in place. They're just under the gum line. What you're seeing here is this lower section of the implant sticking out of the gum, and that gives us the ability to connect porcelain teeth, as you can see here, 3 porcelain teeth added onto that structure within a matter of 2 weeks. In fact, at the very first visit, I can attach temporary teeth to make that space that would create 3 artificial teeth made of acrylic that can actually get rid of the denture upon insertion of those implants. So there are no incisions, as you can see, no stitches. We can immediately carry some temporary teeth. Permanent teeth are attached just a few weeks later. And the treatment time, instead of being months of waiting and hours of surgical procedure. It's only a 2 or 3 hours treatment between the start and the finish. So those 3 implants can be placed within an hour, hour and a half, and the 3 teeth are basically finished off in about a 1 hour visit a couple of weeks later on. This gentleman, Dr. Gordon Christensen, is renowned as an international authority in all manner of dental advancements. So he's written a little article in which he states the mini implant has arrived. Now more patients have been served successfully at reduced cost with minimized pain and trauma, patients who could not have been treated with implants otherwise. And that's so true. Many patients have reduced ridges. The bone structure where the tooth has been removed years ago has actually shrunk. So grafting, bone grafts are very much a part of surgical implant procedures. Whereas with this technique, with the keyhole technique, you can forget about bone grafts. We just don't need to worry about that sort of complexity. The long-term results of this technique have been analyzed around the world, but notably this report here from an 11-year survival analysis of 5,500 of these mini dental implants. The findings by Dr. Todd Shatkin from Buffalo, New York, of those 5,500 indicated that if you've got non-removable, the fixed upper teeth or fixed lower teeth, there's about a 96% success rate over a 10 or 11-year period. Certainly 4% do fail, and that's just part of the course. It's beyond your control and our control as to whether those sort of implants will hold or not. But even with the best of efforts, best of attempts, 4% do fail, and that's not a big issue when they do, because we always come up with other alternatives to resolve those concerns. So here we go, 95-96% success rates over a 10+ year period. Now, here's a gentleman who actually had a surgical implant placed at one stage and then had a keyhole implant procedure on the other side. Let's have a listen to what he says.
I've just had my second implant. Now, what's interesting about it is last time I was in a lot of pain, a lot of anguish for the whole thing. But this time, it was a situation where I came in, I was taken care of, everything was fantastic. And next thing I remember waking up at home. But more importantly, with this implant, there was absolutely no pain at any point in time, not even a discomfort when I got home. So it was absolutely fantastic. I've just had the tooth placed in. I'm really happy. Believe me, for a guy who's absolutely panicking about coming to a dentist, it was a great experience.
This gentleman, having had the first experience, actually wanted to be asleep for the second experience, and I mentioned to him that it was completely unnecessary. But the fear that he'd had, the experience that he'd had, gave him tremendous concern that he'd go through something unpleasant again. So that's why he mentions that when he woke up and he was at home and he had no recollection of anything unpleasant going on. We will share a few more testimonials with you in a moment, and but before I do, let me just run through a couple of simple sort of cases or simple sort of situations the patients come in with. So the replacement of a single missing tooth is a very common treatment that we carry out, and often patients are wearing these sort of chrome dentures. You can see there's one single tooth on that. Considering the bulk of chrome that is has to be worn by this patient, it's a shame to have all of that structure sitting in the roof of one's mouth just for one tooth. So the simple solution is this. There's the little implant in place, here's the x-ray of that implant, and there's the final result. Very straightforward, and the treatment time took about 90 minutes. It takes about 90 minutes to do that sort of treatment. This is a gentleman who actually went through that procedure.
When I was 17, I had an orthodontist who made a gap wider because I was naturally born without a tooth. I then had a implant put in, which was screwed in. It wasn't particularly painful. So that was 7 years ago when I was 17. I'm now 24 and I've had no problems with it.
That final statement that he makes, that I had no problem with it, is something that we hear constantly. Patients are absolutely delighted with the result of this sort of treatment. So here we are with replacing a side tooth. Again, a very common situation of a missing premolar here, sometimes visible when one smiles. So the placement of the implant is very straightforward. As you can see, there's no bleeding, there's no cutting of the gum, there's no stitching. It's a very straightforward insertion, and before you know it, we've got a porcelain tooth on there that looks as though it's actually growing out of the gum. Total treatment time in this case was only about an hour. And this lady tells her story about having had something similar, but on both sides of her mouth. So we'll go back to that. That's what's happening here.
I came to see Dr. Shumalian in July last year. I had a baby tooth, no permanent tooth. I bit into an olive. The tooth was loose, and of course it fell out. I hated my plate and popped in and came and had the 2 permanent implants. The best thing I've ever done in my life. I expected it to be uncomfortable, didn't even feel it. In fact, I almost fell asleep while it was being done. A week later, I came and had the permanent one attached, and as I said, it's just the best thing. So anyone who's got a plate, there's no option except to come and have a permanent implant.
Thank you. So a number of years ago, back in 2003, I had a wonderful lady come to visit me who was wearing a denture, this particular denture, and she was very, very trusting in my skills and ability and allowed me to perform the first keyhole implant procedure here in Australia. And she was wearing this very large, I think it was 9-tooth partial denture, and she unfortunately wasn't suitable for major complex surgery like using the traditional implants. And I basically said to her, well, we've got this new technique that we could consider for her, and she said, let's go ahead and do this keyhole technique. Because of her and the success of that, the successful result I was able to achieve for her, I've now since 2003, carried out more than 12,000 of these procedures, 12,000 of these implant insertions and replacements, and conducted the multiple seminars, online courses, webinars for dentists around the world. And it all comes back to this wonderful lady who was brave enough to trust me to perform something completely new and untried in Australia for her. You can see the result. It's a beautiful end result. In the roof of her mouth, she no longer has a large denture. Let's go back and have a look at those pictures again. This was the situation with her missing teeth. Now, with the beautiful technique that we call keyhole implant dentistry, she was able to achieve a non-removable set of teeth on that right side. As you can see here, let's point that out. From here all the way around, nothing in the roof of her mouth, no denture. And bless her, she gave us this testimonial.
In 2003, I was wearing an upper denture, which I did not like. I came to Dr. Shumalian, who said that I could have these mini implants on which to put proper teeth. I did so. It was totally non-invasive, and I've never looked back since.
When I think about this wonderful lady, I actually get a tear in my eye because she passed away only a little while ago. And the last 12 years of her life were spent with the ability to enjoy every aspect that her new strong set of teeth could provide for her. She was able to enjoy foods comfortably, smiled comfortably, engage socially. It's just a marvelous thing from my perspective as a dentist, as an implant dentist, to provide my patients with an improved quality of life. Wearing dentures is something anyone can get used to, but there is a better quality of life to be enjoyed with non-removable teeth. Non-removable teeth are the natural condition we should have, and it's with that desire not to cause complex treatments, not to create complexity with the treatments that we perform, that I carry out these treatments for my patients, hoping that they will appreciate the refinement, the elegance of what we've created for them for their benefit. So here are her x-rays, a number of implants in place. There they are 8 or 9 years later, and it's a wonderful outcome, a wonderful outcome. Now, sometimes patients don't want to proceed on to the idea of having completely non-removable teeth, and they prefer to just continue with their denture. But with lower dentures, they're very, very loose, often quite unstable. So this technique of placing 4 of the keyhole implants, as you can see here in the jaw, can actually stabilize a denture magnificently. We can, in a 2-hour period, convert a loose, floppy denture into a stable, rock-solid set of teeth with which one can enjoy life magnificently. So sometimes we have flat ridges like this, lower jaw, the bone structure is completely resolved. There's nothing there to actually hold a denture. So 4 of these little implants can be placed in a short period of time, and we put little housings, little connections on the inside of the denture, which with rubber O-rings connect to the denture very, very effectively. We can also do it for the upper jaw. Generally not necessary for the upper jaw, but some people prefer to have something a bit more stable. But we don't normally use 6 or preferably 8 implants in the upper jaw to achieve this. Here you can see the 6 in place and a denture without a palate. You may have noticed that there's no coverage of the roof of the mouth. This is a wonderful way to be able to sense the textures and the flavors of your food more so than if it were a full, complete palatal coverage denture. This gentleman had that sort of an experience, and let's have a listen to what he had to say.
I found the teeth extremely good. They've been solid in my mouth. I'm able to eat a meal. I've been able to taste my food, which is very important as far as I'm concerned. But no, I've never been happy with my teeth. I've had problems with teeth most of my life, and I've had plates, etc. But this is something I'm really, really pleased with, and I'm extremely happy that I've done it.
So this is what he's talking about, denture stabilization. A very conservative
and fantastic.
It's a very refined way of helping our patients. This lady had experienced a terrible lot of dental experiences, as she said, and unfortunately, she had difficulties finding someone who could help her. And finally, when she did, we were able to give her the results she was looking for. So I'll continue on with her story right now.
Hi. After years of horrific dental experiences and putting up with a lower metal partial denture for years, which I hated, I did a lot of research on the internet, went to see 3 other implant specialists. First ones told me I couldn't have implants, others said I needed bone grafts, and it was all getting so expensive and so hard. I was even going to go to Thailand. I was even, sent over some x-rays over to Thailand. I was getting pretty desperate. And then I came here and saw Dr. Shulmanian, and he did a lot of checking and said yes, I could have these mini diameter implants. And of course, I asked a lot of questions because some dentists said no, some said yes. And after he fully explained everything to me and the minimal procedure that would be needed, I thought, wow, this is what I've been looking for. And sorry, a bit teary because he was so good. And anyway, I agreed to have it done, and the cost was going to be a lot better than what I expected, and to be able to have this done in a couple of weeks without travelling to and from Thailand and things like that and stitches, I thought this is great. Anyway, I came here yesterday very nervous, wondering what to expect, and it was really, really good. There was just a very small amount of pain, nothing that was any worse than what I'd had with any other dental experiences. I went home, had to the motel, had a good night's sleep, and came back this morning where he completed the other side. And I'm just very pleased I came here.
Very heartwarming. So here's a situation which many patients have, basically that of no lower back teeth, and with that sort of scenario where you're wearing a partial denture, we can place a number, whether it be 3, 4, 5, or 6 implants on each side, and here you see 5 on that side, and the bridge is constructed in a porcelain material. You can see again, no stitches. There's no incision anywhere. There's nothing to stitch up. We're not damaging the gums, the soft tissue. We're not putting our patients through awful surgical procedures. No grafting, nothing unpleasant. So, as she testified, it's surprisingly comfortable. Well, minimal pain, generally requiring some Panadols or Panadine after the procedure is done, but just for that afternoon, sometimes the next day as well. But generally, a very manageable and tolerable treatment without swelling and all the rest of it. So here are the x-rays with the missing teeth and with the implants in place. You can see 5 on each side, various designs to carry those.
About 4 weeks ago, I had the implants put in, and just temporary ones, temporary teeth to get me going for a couple of weeks till the real teeth to replace them with permanent teeth. Had no problem with that, and now it's been around 2 weeks since I've had the permanent teeth in, and everything's going great. I found with Christmas Day I could eat everything, cashews, everything, not worrying. I didn't have to run off and clean them. I've had no problems whatsoever, and it just feels really good to get rid of a denture. And there's no pain, and everything feels natural. I'm just back here today for a little bit of fixing up and to make sure I've been cleaning them okay, and so far so good.
That video was taken about 8 or 9 years ago, so it's lovely to see that everything is still going very well for him. So my current fees for keyhole implant dentistry, basically a single implant and crown at $2,800, and for a double implant and crown for back teeth is about $3,500. So here we are with the side tooths. You can see it's basically the placement of the implant, a temporary tooth, and then that's the temporary tooth there. You can see right there. That's a temporary acrylic tooth before the permanent one is seated. And again, for a front tooth, including cosmetically refined temporary tooth, there we are with the permanent tooth in place. All good. Where's that? What's that arrow? There you are. That's the temporary tooth again, which looks quite reasonable. A back tooth normally requires double implants because of the natural anatomy of a back tooth is usually two implants, 2 roots. So we put in 2 implants to carry the load. And there you are. You can see the image there with the double implant for a single crown. Very good. So hopefully that's been of benefit to you. You can understand why we do what we do. I just don't want to put patients through unpleasantness and pain and suffering and unnecessary expense if we don't have to, because the technology is there. We just have far more refined methods now than ever before. So if you'd like to find out more about this, you're certainly welcome to download a book that I've written. It is 160 pages. You don't have to read all of it, but you can glance through it and get. It basically goes into greater detail of the information I've given you today. You can go to my website at keyholeimplant.dentistry.com.au and download it. You can see this is actually the page, the image on the page of my website, and there it is. There's the book called Options for the Replacement of Your Missing Teeth, and you can just click that, and it's a free download, and you can read it on your computer or print it out if you want to, and it'll give you tremendous insight into this wonderful technique that I called keyhole implant dentistry. So the website is keyholeimplant.dentistry.com.au. Just click on that image, that picture of the book, and you'll be able to download it to your computer. Now, there's the arrow to say where you'll have to click. Now, I want to also give you something that I mentioned earlier, that I want to give you some sort of a little gift, a benefit for having attended this webinar and stayed right to the end. So I want to give you this certificate of appreciation. It is to the value of $100 off, well, basically $100 value per tooth you need to have replaced. And if you present this at the time that we are actually going to perform your treatment, it doesn't apply to the consultation and x-rays, the first visit that we have with you. It applies to the actual treatment if you decide to go ahead with having your treatment done in our practice at the Australian National Centre for Keyhole Implant Dentistry. And the phone number and address, as I mentioned earlier, is here. In fact, you can see the phone number there. It's on that screen for you anyway, 9411 5116. It's on the certificate as well. So if you go to keyholeimplantdentistry.com.au again, but this time put a /certificate.html. So .com.au, keyholeimplantdentistry.com.au /certificate.html. So I'll wait on for you to write that a little bit, just so you can mark that down on a slip of paper. So as I mentioned, so this will entitle you, if you decide to go ahead with treatment, to basically $100 off the cost of each replacement tooth, whether you need 1, 2, 3, or 10 or 15 of them. We will take $100 off for each and every tooth you need to have replaced. So that website again is keyholeimplantdentistry.com.au /certificate.html. Basically, when you go there, just click on that image, and it'll download that to your computer as well. Just print it out and bring it with you when we're doing your treatment. And finally, I'd like you to feel comfortable to call and speak to Shannon. Shannon is a lady who's actually, that's not her image, by the way. She doesn't like having her image on the screen, but she's been with me for over 21 years. A fantastic lady who will answer all your questions and take care of you in the best manner possible. She'll try and get you in as quickly as we can. Normally, there's a wait time of a few months, 2 or 3 months, to get in to see me, and usually another month or so before I can actually do treatments for you. But if you let Shannon know that you've stayed until the end of this webinar, which is essential, let her know you stayed right at the end of the webinar, she will give you a priority appointment within 10 days of your call, provided I'm in Sydney, because sometimes I am away, within 10 days of your call, effectively allowing you to jump to the front of the queue for your examination and consultation and your treatment appointments. So speak to Shannon, a wonderful lady who will do her very best to take care of you as promptly as possible. So here we are. I've got her phone number, our phone number there again, 02 9411 5116 to speak to Shannon. And remember, you can go to keyholeimplantdentistry.com.au to download the book Options for the Replacement of Your Missing Teeth. So it's a free ebook. And you can also go to keyholeimplantdentistry.com.au /certificate.html. Once you've accessed that website, you'll again be able to review the information I've given you, and hopefully you'll feel confident enough to either call our practice for me to meet you personally and to help you with your tooth replacement problems, or if you prefer, if you find it difficult to get to Sydney, the website for the Australian Society for Conservative Implant Dentistry is ascid.org. ascid.org if you want to have access to practitioners who've attended my courses. So feel free to go to that site, have a look if there's someone you need in Brisbane or Melbourne or Perth or Adelaide, and maybe there's someone there who will be able to help you. Often I find that they have done a few and have for some reason felt as though they're uncomfortable about doing more, because it is complex treatment, but in the hands of experienced practitioners, it's, well, I consider it very simple. So often they will just refer you to my practice anyway. So feel free to use that facility as well too. So right now I'd like to thank you for having stayed till the end. I hope you've gotten tremendous information tremendous value from the time you've spent with me, and that you will take the initiative to improve your life as well by benefiting from the advancements we've created with this very refined and elegant technique that we refer to as keyhole implant dentistry. Thank you for watching. All the very best. God bless.